I apologize, my casual clothing because of my baggage has not delivered. My tie is on the way. I have no financial exposures. The background, preoperative fundus autofluorescence images in idiopathic macular hole is inspired to reflect the anatomical change of the hyperfluorescent retinal pigment epithelium through the macular hole. Hypofluorescent fluid curve reflect relatively hypofluorescent intraocular cysts. So most of the autofluorescence is from the RP layers through that macular hole. And what's going on that after macular hole closures? We can see that after the gas absorbed, but how we can see that immediately after the macular hole closures? Possibly disappearance of hyperfluorescent RP after surgical closure macular hole represent maybe blockage of the FAF from RP layers. So how we can visualize through the gas bubbles? Ultra-angle image from the step source OCT image through the infrared gas can be, we can obtain the image through the gas bubbles. And especially that after day one, we can see very nice image FAF. And the good thing is that they use in the green lasers. And we can use the sweat source OCT, and the macular area was detected with the sweat source OCT in 97% of gas-free diet after macular surgery on the next day. This is the difference of the wavelengths of the NFAF. Blue laser, this is easily the blockage from the macular yellow pigment, but if we use the green laser, it's a less effect from the exam field. This is the macular epiretinal membrane, the patient after the epiretinal membranes, and we can see some fluorescent after in the green lasers. So possibly FAF after macular hole closure can be correlated with the visual improvement and the status photoreceptor and RP cell detected with the optical OCT. The aim of this study is to evaluate the fundus autofluorescence image with a green laser and the SSOCT image immediately after the macular hole surgery. So we use the 25 and 27 gauge vitrectomy and use the air and SEP6 in 59 eyes. So we use the width angle FAF image using the Optus 200TX, and we use a green lasers. We're taken at the before and after surgery in all eyes. And we also use the sweat source OCTs. So visual outcome is compared between the eyes with hypofluorescent and hypofluorescent at the closed macular hole in gas-filled eyes. So result that the mean age was 63 years, and there's some inclusion of the high myopic eyes. The 5 eyes, so macular hole closure is detected 56 of the 59 eyes or 90% through the interval gas in with SSOCT, and this study is concluded in that 56 eyes. So these are represented cases where that we can see the hyper FAF at the macular holes, and if we disappear with the day ones, and this is confirmed that the SSOCT, and this disappearance of the hyper FAF is maintained until the last visit. This is another patient where that we can some hyper FAF is remain on the possibly day one, and it persists on the possibly 1 month. And this is a comparison of the two groups. The operative vision is preoperative vision is significantly slightly better in the hyper FAF group, but it's not statistically significant. But the postoperative vision is significantly improved at 6 months in 40 eyes. In with the hyper FAF at the closed macular hole the next days. And 42 eyes, both groups had the visual improvement in significant, but the hyper FAF group has better visual outcomes. So we look at the preoperative FAF image. Some patients had a hyper FAF ring at the open the macular hole, and if it disappeared at the postoperatively, and we compared the two groups with left lower slide showing that the hyper FAF link is positive around the hyper reflecting macular hole. And the hyper-refractive link is observed in 12 eyes, and link negative is 44 eyes. If you see that the hyper-FF links in the preoperative leads, they will persist at the possibly hyper-FF at the closed macro hole in 92%. So conclusion, ultra-wide analog FF image can be detected in the gas-filled eyes. Possibly immediately disappearance of hyper-FF at the macro hole may not always represent macro hole closure, but a persistent hyper-FF of the closed macro hole may correlate to poor visual outcomes. Preoperative hyperfluorescent link may predict a possibly persist hyper-FF at closed macro hole. Thank you for your attention.
Thank you for the nice presentation. I would have a question to you. Did you correlate your post-operative results with pre-operative data?
Yeah.
Do you think that maybe hyper autofluorescence is correlated to larger macular holes, to an older age, or to anything else?
We haven't taken a look at the data with that comparison with the macular hole diameters, but maybe I think it's maybe possible correlations between the diameter of the macular hole and maybe the duration of the disease, because longer the macular hole is at the longer period maybe have a persistent hyper-FAF.
Thank you.
Yes, I have a question. Some cases there is a lucid interval, during the healing of or the closure of the macular hole. Have you noticed these in your cases, and does it have any significance of the visual recovery using the fundus autofluorescence? The lucid interval, there is in these cases there is a fluid, or there is a space.
Yeah.
The hole is closed, but there is a space between the inner retinal layers and the RPE.
Yeah, that's right. And if the patient has a persistent subretinal fluid, that is higher incidence of the hyper-FF at the closed macro hole. That's right. Yeah.
Okay. Any questions? Comments? Okay. Thank you.